have you ever at a point cried or shed tears at the word before?
Yes.
Have you ever heard people say nurses are heartless? Nurses don't have what we call sympathy or abadaye? Have you ever heard anything like that before? Well, mostly when we go to the hospitals, from experiences that people have gathered, some say that some nurses are very wicked. Others also say because they send their wards to the hospital and they end up dying. Some nurses are not, born to be nurses. But then we are here to discuss a very emotional topic this evening, and this is something we are going to get from a resource person, and she happens to be Lady Bex. So guys, yeah, she's a nurse. But you are a nurse, so you are the one who is going to share the experience.
Hey.
So guys, I am Fel.
I'm Bex.
And together we are
FelBeck TV.
Intro. So Lady Bex happens to work at the child health department at the Kolebu Hospital, and today she's going to share with us she being a mother.
Ooh.
And at the same time being a nurse. How is it like when especially she's a mother who sees people's child coming to the ward and sometimes they end up not surviving? I just want to probe further so that we will learn one or two from this video. So Lady Bex,
Yes.
my first question is, how is it like when as a mother and again as a nurse people bring in their children and are not feeling well? How do you feel sometimes?
Well, like, I don't even know how to start this, but it's not a nice feeling at all.
Okay.
Even when I wasn't a mother, even before DM came, Charlie, it was not a nice experience at all.
Yeah.
Because you seeing your baby boy, your baby girl going through so much pain, looking on, thinking you can do something like to relieve them of that pain, but at that point there is nothing you can do to help them in any way. They have to go through it, and like it's so heartbreaking. And at times the common headache, like heat, running temperature, is even something else. Like you feel so uncomfortable when he gets cold, like come and see me here. It's like, and I understand them. And my word, especially for very critically ill children. So the moment they get to my end, I know that Charlie is very critical. So from running normal temperature or cold, and I can't stand it. I can't imagine Didi at my word. Like I can't imagine it. The question pops up in my head. I'm like, what will I do if it was me?
So it means whenever you are attending to patients at the ward, sometimes you picture your son, like assuming it was your son.
Yes.
It comes in mind like that.
It comes, especially when they are within Didi's age range.
Okay.
Like I try as much as possible to make them feel very comfortable, because I can understand their mother's desperation. I can understand their anxiety, their fear. So I try as much as possible to make them feel like relieved. At times we are also handicapped in a way. Like you can't.
Okay, so when you say handicap, you mean what?
Like you can't do much to help. Like, so you have to give medication, you have to do this, you've done it, still baby is not fine. And it's not like when you give the medication today, tomorrow baby is fine. No, it will go through some process. So that process, 2 days, 3 days, 4 days before you see some improvement. During those days, like it's like you can't do anything. You can just carry baby when baby is crying, like cuddle them, play lullaby for them, or this children music for them.
What range of children do you normally have at your ward?
Oh, we can have from day 0. If I mean day 0, like the day baby is born, I mean to 14 years. That's is it 14? No, to 17 or so. That's when they see you as a child. So yeah, from that age range.
Yeah, so a child is somebody who is below the age of 18 years.
Yes, so we get from that. If you are not 18, they won't admit you at the adult side. So no matter how huge or how big you are, you still end up.
So I want to find out. So you mean from age 0 to that level?
Yeah.
What will happen to age 0 child for that child to be brought to your ward?
So age 0 child, it could mean that there were complications during childbirth.
Complications, break it down. You see, we are not in the field with you, so break it down.
There are lots of things that will cause a day 0 child to be admitted. So when you are going to give birth, baby can aspirate. If you say aspirate, it means that baby was trying to swallow. You see babies lie in fluid in the mother's tummy, in the womb. They try to swallow some, and so if baby mistakenly tried to swallow but it didn't go to the stomach but ends up in the lungs, that is aspiration.
So they try to swallow what? The fluid? Yeah,
the fluid. That's what they use to learn how to swallow, suck, and all that. So that the moment they come out, they know how to suck, and so it's also a learning process for them in there. So at times that they can aspirate some of the fluid, or we have something called meconium. So meconium is like their first poo-poo. It's greenish. So they can poo in the mother's womb and then they will aspirate it.
Whoa.
Yes. So that's one. And 2, it could be that they were preterm. It means they were not up to the maturity. You know, we have up to 40 weeks. So between 38 to 40 weeks, you can give birth and the term is at full term. So anything below that, they will say the baby is preterm. So we have early preterm, like the 28 thereabout, and we have the late preterm around 33 weeks, 34 weeks, up to 37, or the term is at late preterm. But if even you give birth late preterm and their weight is okay, there's nothing wrong with them, you can go home. But if they are finding it difficult to breathe because their lungs have not fully developed and they've come out, they have to be admitted. And at times too, if there is prolonged labor, so you are in labor, it's time for you to push. You, the mother, you are not making so much effort to push. You delay the pushing period. It affects the baby in a way. So in the end, baby has to be resuscitated and then admitted.
So at what point in time, or is there any instances where, like, dealing with that patient, you had to, move away from being a nurse to a mother?
Well, I can basically say that all the female nurses at Child Health are mothers.
So wait, the reason why I'm asking you this question is, we know that when you are in the nursing field, professionalism must come to pass. Yeah. So you don't have to be expressing sentiments, you don't have to show emotions and stuff to I know you know where I'm coming from.
Yes, I understand.
So at what point in time did you actually say that, no, this one, Charlie, let me put the uniform aside and become a mother because I also have a son?
You see, you can't help it when you see a child helpless, even if you've not given birth.
Okay.
So like I was saying earlier, most female nurses on the children's department are basically mothers. Yeah. Because you see a child going through so much pain. You, an adult, common headache or menstrual pains is something else, and a child, and you tend to ask a question, what happened? Yeah. Like, God, why? Why are they going through so much pain? And you can barely do. So at a point, like, emotions will come in. you end up carrying them. Like, we back a lot of babies, you carry them, a lot of them. So at a point where you end up carrying somebody's child, at that point, uniform is aside.
There you become a mother.
Like, you are, yes.
So do you get scared sometimes?
Scared as in?
So looking at some of the cases that comes to the ward, do you
I was scared from when I was...
get, like, scared, or do you get some leaps in your heart, like...
I was scared for my pregnancy time.
Oh, wow. From your pregnancy time?
I tell you.
Because of what you have been seeing at the ward?
Yes.
Charlie, share.
So, you see some of the like anomalies I made mention of earlier.
Yeah.
Some can be detected through scan. So when you get to 20 weeks, 22 weeks, they will ask you to do anomaly scan per your facility that you are attending your antenatal. So I was asked to go and do anomaly scan. I kept asking questions. So, are you seeing my baby's head? Is it okay? Is my baby's tummy there? Are you seeing the anus? How the fingers? How many digits? The toes? How many digits? Is the length of the leg okay? That of the hands, are they okay? Is the stomach there? Like, are you seeing my baby's intestines?
So it means anybody who gets pregnant and goes to do setting should be asking questions like this, right?
Yeah, you should ask. At times they will tell you at that point they can't see everything. So I remember during my last scan I did, I asked them whether they saw my baby's anus, because we have cases where children are born without anus.
Wow.
The sonographer was laughing at me. We were having a chat actually, so he got to know that I'm a nurse and a child health. I said, are you afraid? I said, yes, I am. We get cases like that, so I have to make sure my baby has an anus. So I asked, and they said, yeah, it was there.
So it means we've learned something. We should be asking questions
when you are doing scan.
Okay.
If you see something, and let them make you see the scan. Let them explain to you. So where I took my scan, there was a TV directly opposite me. While they were looking on the machine, I was looking on a TV, and I was equally seeing what they were seeing, and they were showing me, this is my baby's head, it measures the size. The size, they will tell you. If it's too big, they will let you know the possible conditions that will make your baby's head too big. They will tell you the weight and all that. So be communicating. Don't just go and lie there for them to do the scan for you. Ask a lot of questions.
So when you were talking, I remember you were saying something about some of the cases that comes to the ward, and I want to ask, so what are some of the predominant cases that comes, and which ones should parents be so much keen and careful about? So we want to know the types of cases that normally comes there that gets you so worried, and you keep on asking the question, what happened?
Okay.
Yeah.
So in children, even headache is an issue that you shouldn't play with. Stomach ache, any little thing that you an adult will overlook is a big deal for a child. Malaria is a big deal for a child. We've had instances where malaria, you say common malaria, has taken the life of a child because actions were delayed. Like, they didn't take quick action. And I want to use this platform, this channel, to please I want to beg our mothers, please don't hold the nose of our children to force them to eat.
Why?
We have a condition called aspiration, like what I explained, like babies. Yes, aspiration pneumonia. It is a case that is claiming a lot of lives, children's lives on our ward. And you come and we ask them why, and they will give you excuses. Baby wasn't eating, so we're forcefully feeding baby. And please,
how is that one done? Is it the one that they hold your nose and they put the food.
Yes, so in attempt to breathe, you open your mouth and then they will pour the porridge or whatever food they are giving you, and then you have to swallow by force. Please.
It kills the children.
Yes, our mothers. The
Wow.
food accidentally gets into the lungs and you can't get it out.
But no, wait. Mostly they do that thing so that the child will be able to eat something. Because they claim the child doesn't eat.
Yes, I know. Please, especially when you are switching from the breast milk to solid food, please take your time for them. It is a new thing for them. It is a new food you are introducing to them. You don't expect them to take the whole bowl or the whole cup of porridge you brought them. No, if they take 1 teaspoon, 2 teaspoons, please allow them. Try again another time. They will take more than the first one they took. Try again. Their taste buds are getting adjusted to the food you are introducing them to. So please again. And like the way they go through it is terrible. Your lungs is what helps you to breathe. Yeah. So if water goes in there, how are you going to breathe? They become very breathless and restless, and they have to put them on life support, and majority don't make it. Yeah. Just because you were forcing them to eat. You think you are doing them good, but the consequences is not good.
Okay.
So please, if they don't want to eat, just give them food in bits, but at frequent intervals. So if they will take 2 teaspoons at a go, give them 2 hours later, give them 2 teaspoons. 2 hours later, give them 2 teaspoons. That one is much better than forcing them to drink a whole cup of porridge, blocking their nose, forcing the food down their throat, and it will end up somewhere. And then you the mother, now if you see your child, like when they come, you could see the mother like seeing your child on life support, and why you like, and you keep blaming yourself. That conscience, like I don't want to be in that situation where you have to blame yourself for something bad that happened to your child. So all right, please.
All right. So I can feel in your voice you are getting very emotional, and seriously, I think this is something that needs to reach out to everybody. So guys, share this video. Subscribe if you're new. If you are new to this channel, make sure you pass it on. My last question would be: have you ever, at a point, cried or shed tears at the word before?
Yes.
Oh wow.
See, so my unit was kind of new when I started work. I got permanent job at Koyobu. Yeah. So when we started fresh, Charlie, it wasn't easy. Like we were all if I say all, I mean all the staff were emotionally broke down because we weren't getting a lot of success cases. So it made us emotionally unstable. You cry 2-3 days, they bring another patient, you cry again 2-3 days.
So you were crying 2-3 days, you were crying
2-3 days, they will bring a patient, and at times you get a patient, they will stay very long, so you get like emotionally attached, sort of.
And but is that not against your code of ethics?
You can't help it. It's something that happens. Okay. And I kind of wonder why some people think we nurses are heartless.
You're heartless because we believe, just like the military guys, they have been trained to be hardcore. So we also think, nurses and co. Since you've seen dead bodies and stuff, Charlie, what is there to see again?
That one rather humbles us.
The dead bodies. We'll talk about the dead bodies in our subsequent videos. But I think.
But what I'm saying is, we are not heartless. Maybe I can't generalize it.
Okay.
But I would say some of us, we are not heartless. We are human beings.
So guys,
Emotions.
I am sure you've enjoyed this video. This was just something that I wanted to talk about because a lot has been expressed anytime she comes from work, and I think it's hard time we begin to share this kind of information. It's more or less like we advocate for these kind of things so that things will change. We love children, and we hope you enjoyed this video. Thanks for watching.
Don't forget to subscribe, hit on the notification button,
share, comment, and like this video. And guys, what are we saying? We are out.